is the left-sided first rib. How can we identify it? If we place it like this in a flat surface, then both the ends will touch the surface equally. But if we rotate it and like this, if we keep it, then the vertebral end, it will be higher. Sternal end will touch it. Now this is the left-sided first rib, anatomical position. The head is directed medially and it is contained within the vertebral end. Neck directed posterolaterally, sternal end directed obliquely downwards and above than the head, and the superior surface is marked by two shallow grooves, anterior and posterior shallow grooves. Now the parts. Parts are, first is upper end, shaft, lower end. Upper end has head, neck, tubercle. Head consists of this facet which articulates with the facet on the thoracic vertebra and forms the chondrovertebral joint. Then there is a ligament which is present in the superior part which articulates with the transverse process of the thoracic vertebra and forms superior costotransverse ligament, and inferiorly it articulates by the lateral costotransverse ligament. Then neck. Inferior costotransverse ligament. Then neck. Neck from medial to lateral, relations of sympathetic trunk, first posterior intercostal vein, superior intercostal artery, and anterior branch of the ventral ramus of the first thoracic nerve. Then neck is related posterolaterally. Now the tubercle. Tubercle, it articulates with the tip of the transverse process and forms costotransverse joint, and it is attached by a ligament known as the lateral costotransverse ligament. So here is the superior and inferior costotransverse ligament, and here is the lateral costotransverse ligament. Now the superior surface. Superior surface has a scalene tubercle. In front of there is a groove known as the anterior groove, and behind there is posterior groove. Anterior groove is marked by subclavian vein, posterior groove marked by subclavian artery, and in the tubercle there is attachment of the scalenus anterior muscle. There is a posteriorly there is another groove which is marked by the attachment which is the scalenus medius muscle, and in the sternal end there is above subclavius muscle and below costoclavicular ligament. Then it has outer border and inner border. Outer border there is attachment of the first digitation of serratus anterior muscle, and inner border there is attachment hole, that is Sifson's fascia or suprapleural membrane. Then inferior surface. Inferior surface has inferior surface has outer and lower end, outer border, inner border. Outer border there is attachment of the external intercostal muscle. Just medial to it there is attachment of the internal intercostal muscle, and in the inner part there is attachment of the costal pleura and endothoracic fascia. And from above downward there is nerve, artery and vein. Nerve is intercostal artery, intercostal nerve, intercostal artery and intercostal vein.